All right, good afternoon. Not really afternoon. Wala ko bulong si oras karon, no? So anyways, good day to you, BSN 3H and 3I students. So I will be discussing today your burns, okay? Muna atong i-discuss karon sa inyong asynchronous. Hmm. Sana nag-enjoy kayo sa inyong chill time. Okay, so today we'll be discussing about burns. Ayan, meron akong kasabihan sa mga Adobo Republic, no? Kaya pala tayo maitim dahil tayo ay nasunog, no, sa sobrang hot natin. Ayan, so itayo natin ang mga bandera ng mga Adobo Republics diyan. Kung kayo man ay maitim, dahil yan sa pagka-hot ninyo, class. Okay, bakit ang hina or ang bagal nito? Okay, so anyways, without further delay, let us start with our discussion for your burns. Okay, now, when we're talking about burns, we have to review first your anatomy and physiology of your integumentary system, because these are the system, or this is the system that basically is um, involved in your burns. No, yung ating mga partial thickness burns, okay, superficial thickness burns, mga ganun na bagay. Okay, because when we're talking about your skin, it has layers. No, you have there your epidermis, which is your superficial most layer of your skin. And then below that one is your dermis. Now, what we have to remember about the layers is that in your epidermis, all of the things that you can touch on your skin, they are dead already. Okay? It is basically keratin. Okay? Itong gumagawa ng waterproof sa ating skin, or the one that is basically giving us the characteristic of being waterproof. It is because of your keratin, and that is being secreted by your keratinocytes. Okay? So aside from that one, of course, your epidermis, wala talaga yan siyang blood vessels. That is what you call your avascular. Okay? Avascular yan siya. At the same time, no? At the same time, how do you call this? You don't also have there, o yun nga, yung ating mga blood vessels. Okay? Sir, paano ba yan siya manonurish? Of course, you have there the dermis. The dermis, that is the one that is vascularized. Okay, that means that you can locate your blood vessels there. Aside from the blood vessels, you can also locate there yung mga nerves natin. Okay, that is why we can feel, no, kasi class, yung ating epidermis, millimeters na talaga yan. Ang nipis-nipis niyan. Okay, and below that one, you have there the dermis that contains your nerve endings. Okay, yung mga nerves natin. That's why it can feel, okay, it can feel pain as well. It can feel pinch, the pressure. Iba-iba yan talaga. No? Kasi may times where if these receptors are damaged, okay, it can only feel pressure. Okay, it can no longer feel yung mga pinching natin na pain or yung mga sharp pain natin. Okay, if ever it gets damaged, no, it can no longer, or it has a delayed reaction for your heat, no. So mao na siya nahitabo sa akong lower extremities. Okay, it can no longer, or it has delay response when it comes to, or feeling, no, it has a delayed response when feeling cold or hot, no, kung buuan na init na tubig, dugay pa kaayo, no, it's delayed, no, mga seconds lang naman. Okay, pero for a normal person, that is like milliseconds lang, eh. Mabilis masyado yan. Okay, now going back to the functions of the skin, remember, okay, this is the thing that we need to remember para malaman natin kung bakit nagkakaroon ng electrolyte imbalance. Number one is, of course, it helps in your what? Vitamin D synthesis. Helps in vitamin D synthesis. Okay, it does not form your active vitamin D. Okay, instead it is the kidney that activates your vitamin D. Okay, it is the one that metabolizes or forms your active vitamin D, so that yung active na vitamin D, okay, will, anong tawag ito, will act on your intestines para increase ang absorption ng ating calcium. Okay, now remember that if there is burn or nasunog yung ating tao or yung ating patient, they are at risk for hypocalcemia. Okay, mababa ang ating calcium levels dyan. We will also be discussing the other electrolyte imbalances dito. Magkakaroon ng hyperkalemia and magkakaroon din tayo ng hypokalemia. Okay? Ayan. So, what else of the function of the skin that is helpful, no? We will be focusing on this one, yung helps in vitamin D synthesis para sa ating electrolyte imbalance. Aside from that one, of course, protection talaga yan, no? Protection for your any physical injury, no? It is, remember that your skin is the first line of defense. No, mechanical injury, chemical injury, mga physical injury, desiccation. When we say desiccation, this means that it is not allowing your liquids or your fluids to come out, or to enter. So nothing leaves your skin, or not no fluids can leak through your skin, aside na lang siguro kung magkakaroon tayo ng insensible water loss during our exercise, okay, or after the exercise pala, kasi magsusweat tayo niyan. Okay, but aside from that one, it is responsible for your desiccation, okay, para hindi tayo ma-dehydrated. Next is, of course, you have there the parts of the integumentary. The main organ there is your skin, and it is the largest organ of the body. And for the other parts, you have there your skin derivatives. Okay, pag sinasabi natin skin derivatives, okay, these are yung mga additives or yung mga add-ons ba. So you have there your hair and nails. Okay? So, and of course, yung mga glands natin. Okay, aside from, these are the skin derivatives, and we also have there your glands. Okay, yung mga sweat glands natin, sebaceous glands natin, yung mga apocrine and eccrine glands. Okay, we can see that one there. Okay, so that is the brief history of your, not history, but it's the brief review of your anatomy and physiology. Now let's talk about your burn. Okay, now by definition, a burn is an injury from exposure to heat. Hindi lang po heat. You have your chemicals, radiation, or electric current leading to sequence of physiologic events, which will be discussed later on. It can lead to irreversible tissue damage if untreated. Kaya aggressive din ang treatment when we're talking about, or when we're trying to treat your burn. Okay, or when we're trying to manage your burn. Okay, kasi ang mataas masyado yung recovery time, okay, that the patient needs. Okay, the management is very lengthy as well. Long term talaga yan sila. Okay, at the same time short term, to really help the body cope up with the tissue injury. Okay? So depending on the severity din ang ating pagka-aggressive sa ating management. Kuha natin. Ayan. So I will be discussing that one later. Now, the four major goals of your burns is, of course, number one talaga ito, prevention. Okay? Who wants to be burned? Ayaw, basta ako, ayaw ko. But I've experienced that one as well. When I was admitted, grabe ka to. Kwento ko sa inyo, class, no? That time, yung 18 days ko doon, madami akong diagnosis doon, no? It's not just one diagnosis, it's a lot, but most of the diagnosis revolves around your fluids and electrolytes, no? I also ano tawag dito? Nakakuha ako ng second degree burn sa likod. Sobrang malaki rin yun, malaki. May peklat ako doon sa likod ngayon. Ayan, so I also had second degree burn, di ba? Kaya ko pala ito, no? Kaya ko pala ito ginuha, no? Na concept, kasi very perfect example of your fluids and electrolytes na patient. Okay. First off is the prevention. Now, let's say, for example, if the prevention did not work. Okay, nagkaroon pa rin na aksidente. Okay, there is now institution of life-saving measures for severely burned person. Okay, kino-compute yung ating total surface body area that is burned. It's what we call your TSBA. No, para there will be a proper or calculated management for that one. Okay, kung ilang percent yung na-burn sa iyong katawan, there is also an exact or approximate na management for that one, for your fluid resuscitation. Okay, may computation yan, and I'll be teaching you that one as well. Okay, so life-saving measures, so dapat buhayin muna natin yung patient natin. That's number 2. Number 3 is prevention of disability and disfigurement through early specialized individual treatment. So dito, class, this is the treatment phase. Okay, dito dito napupunta yung ating mga management. Okay, meron tayong mga phases dyan wherein each management is different from one another. Okay, so this is number 3. Now, once the patient is already ready to be discharged, no, there will be rehabilitation tayo dyan. Para naman, if ever the patient cannot go back, or if the patient cannot function 100%, okay, kasi nga meron siyang mga mataas yung extent ng kanyang burn injury sa kanyang katawan, okay, we try to, this rehabilitation and constructive surgery will try to increase, no, the chances of having a better functional or functioning limbs or functioning body. Kuha natin. So you're trying to, what you're trying to prevent here dito sa 3 natin is we have here yung ating mga common complications such as your compartment syndrome, Okay? And you also have there, that's number one, contractures ang number two natin. Kasi if ever the patient will develop your contractures, okay, mahihirapan na yan siya gumalaw ngayon, especially if the involved area are the limbs, no? Either the upper or the lower limbs or both. Okay? Kasi pag sinasabi natin contractures, makikita niyo yung picture niyan mamaya, dumidikit kasi yung ating mga how do you call this, mga limbs natin. Okay, yung mga joints natin. So dumidikit yan sila. Okay, because of the burned area. Okay, and then tumitigas yan siya, and at the same time, it will now lessen the range of motion of your patient. It will now limit the range of motion of your patient. Yun ang ating, that's what we're trying to prevent here. Okay, and then after that one, if ever the patient will undergo mga constructive surgery, okay, the patient will also undergo rehabilitation programs. Okay, that is number four. So prevention, and then if ever na burn siya, of course, parang it's part of your BLS, para no, institutional life-saving measures. And then third one is that once once the patient is stable already, now there will be prevention of disability and disfigurement. Okay, and next is lastly your rehabilitation. Okay, now this is the physiologic response to burn injury. Ito yung ginagawa ng katawan natin for it to somehow return our body to homeostasis. But again, if we're talking about severe burn or high extent of total body surface area that is burned, okay, mahihirapan talaga yung ating katawan not to return it to homeostasis. But basically, this is the series of events that would occur if ever the patient will be burned or if ever you will be burned. No, simba ko. Maburn lang ta sa atong sa sobra kahat. Korne. Wala ko'y labot ng korne ko. Wala ko'y audience. Okay. So first is, of course, there is a release of vasoactive substance. Remember, sir, bakit ano itong mga vasoactive substance? Now, this here, remember, pag nasusunog ka, you have there your tissue injury. And once there is tissue injury, any tissue injury class, it will now follow your inflammatory response. Okay, inflammatory response natin dyan. Okay? Di ba meron tayong classical signs of your inflammatory response, yung pain, redness, heat, pain, redness, heat. Ano pa ba? Loss of function, pain, redness, heat. Nakalimutan ko yung isa, basta lima yan sila. And the last one is your loss of function. Okay? Redness. Sabi ko na ba yung redness? Pain, heat, redness, loss of function. Kalimutan ko talaga yung isa class. Okay? Anyways, you have there your inflammatory response. And remember in your inflammatory response, meron tayong part doon wherein there is vasospasm and there is also vasodilation. Now here, dito, ang nangyayari dito is nagkakaroon ng release of vasoactive substances. Okay, that is your mga kinines or kinins natin. Okay, if you could still remember yung sa immuno concept ninyo, I don't know if may immuno na kayo. I think wala pa eh. Okay, basta doon sa immuno concept natin, meron tayong mga kinins dyan, mga kinines. You have there your bradykinin, okay? For your pain, you have there your prostaglandin, okay? But anyways, those substances, they will be released, no? Para magkakaroon ng vasodilation. So magkakaroon ng vasodilation. That is a response, ha? So if there is vasoactive substance that is released, magkakaroon ng increased vascular permeability. Now, remember this one. This is very important for you to identify or for you to understand because pag mag-increase ang vascular permeability natin, what happens is that nagkakaroon tayo ng tinatawag na leaky capillaries. Bugo yun ko sa kuan class ba? Sa spelling. Okay, ambot lang kung double L ba na yung capillaries. Lang check ko muna. Okay. Ayan, mali ka talaga si Sir. Double L. Okay, double L walang I. O, diba? Capillaries. Okay? So, magkakaroon ng leaky capillaries. That means that fluids from your intravascular. Sir, saan doon ang fluids na blood man yun? Yes, of course, your blood. Your blood is composed of your plasma and your formed elements. Diba yung formed elements natin, RBC, WBC, and your platelet. Yung plasma natin, doon makikita yung ating mga fluids because 90% of your plasma is water. Okay, or 90+%. Kaya magkakaroon ng leaky capillaries, there will now be a shifting of fluid from your intravascular papunta sa ating tissues or papunta doon sa ating interstitial. Kaya nagkakaroon ng mga butoy-butoy na anay mga bulla, kanang sa skin lesions ninyo in your HA, you have your bulla. Kung maliit lang yung damage, better than vesicles, okay? Kung malaki, bulla, ayan. So, there will now be edema, okay? And you have their increase in your hemoglobin kasi nga nagko-compensate tayo eh, okay? Now, for your edema, it could either go to your increase ang tissue pressure natin. Dito napapasok yung ating mga complications such as your compartment syndrome. Okay? Sir, ano ba yung compartment syndrome? Pag sinasabi natin compartment syndrome class, okay? Let's say for example, I have here a burned area sa aking kamay. Kasi hindi ko mapakita yung legs ko eh. Because of course, hindi ko talaga mapakita yung legs ko. Okay? So, eto na lang muna yung kamay. Just imagine your hand being burned. Okay? Mamamaga yan siya. The tissues inside mamamaga. But basically, magkakaroon ng compartment, nagkakaroon ng compression sa loob eh. Kasi hindi na umiinat yung ating skin dito because it's damaged already. Okay, so nawawalan ng elasticity yan. So magkakaroon ng ano tawag dito, increase in tissue pressure doon sa loob. So what you have to do to address your compartment syndrome, kasi ang nangyayari sa compartment syndrome is that it crushes or it compresses your blood vessels. Once your blood vessels are compressed, what do you think will happen? There will be no hindi dadaloy or pangit yung daluyan ng ating dugo. Okay? So magkakaroon tayo ng hypoxia. Okay, once there is hypoxia, it would lead to or it would worsen the case of the injured tissue. Kasi injured na nga eh, kailangan niya ng oxygen. Okay, and nutrients. Since compressed yung ating mga blood vessels because of your compartment syndrome, it will not go there. Magkakaroon ng necrosis, further tissue necrosis. Okay? Now, ang ginagawa nila dyan is we have there your surgical management, which we'll be talking about later. Yung fasciotomy and escharotomy or escharotomy. Okay, I will be showing you a video of that one as well. No? So what happens there in the surgical management? Okay, they're going to make an incision, okay, para mubuka ang imuhang skin and it will now relieve pressure. Okay, kasi again, your skin is the one or limited nga lang ngayon yung ating pag-stretch ng skin eh. So as your tissues gets inflamed, okay, mas muguot na iyaha dire. To relieve of that pressure, ginakat nila yan siya. They're going to make an incision there. So increased ano tawag ito? Tissue pressure as well. Okay, itong edema din, the effect of your edema, dapat hindi yan siya dito eh. Okay, the effect of your edema is decrease intravascular volume. Sir, bakit magdi-decrease yung intravascular volume? Remember, there is shifting of fluids from the intravascular papunta sa inyong tissues. Kaya nga nagkakaroon ng increased tissue pressure dito eh. Okay, and then we have there your compartment syndrome. Okay, kasi edema tayo, third space shifting, di ba? Third space shift. Okay, so from the intravascular going to your extravascular or to your interstitial. So decrease intravascular volume, magkakaroon tayo ng decreased blood flow. Okay, it will become compromised. Decreased blood flow to your kidneys, skin, and your GI tract. Magkakaroon tayo ng hypoxia dito. Okay, ayan. And remember, pag sinasabi natin kidney, okay, and if we related to your electrolyte imbalance, magkakaroon tayo ng hypocalcemia. Okay? Kasi nga hypoxia eh. So hindi na the kidney does not receive the needed oxygen. Okay? Because of your decreased blood flow. Okay? So pag mahina na yan siya or pag hindi siya receive ng oxygen, if it's left untreated, of course magkakaroon tayo ng renal insufficiency. Okay, and remember that one of the factors or one of the function of your kidney is that it synthesizes or it metabolizes or it forms your active form of your vitamin D. Okay, wherein it will act doon sa ating GI tract to increase the absorption of your calcium. Okay, and dito din kung magkakaroon ng problema sa GI tract natin, magkakaroon ng necrosis. Let's say for example necrosis or tissue necrosis sa inyong sa inyong intestine. Ayan, mas decrease din ang absorption. Okay, not only for the calcium but for all of the nutrients that your body needs. Okay, kaya nagkakaroon ng malnutrition tayo sa burn. And for the skin naman, okay, Ayan, damage na nga yung skin tapos hindi pa talaga nakaka-receive ng hypoxia. Okay, matagal siya mag-heal. And at the same time, you have there the synthesis of your vitamin D, di ba? Synthesis of vitamin D. So if you combine yung mga problems natin sa skin and kidney, hypocalcemia ang labas ng patient natin. And another thing, if there will be renal insufficiency sa kidney natin, okay, there will be a time wherein magkakaroon tayo ng hyperkalemia. Kasi it is the body's way of adjusting eh. Okay, sabi niya, uy, parang when you get burned manggod na nasasali yung mga cells doon, and then inside the cells meron ba ito yung mga fluids ba ya? Okay, and then if the total surface body area is mataas talaga yung extent ng burns natin, of course that would lead to dehydration as well. Okay, kaya magkakaroon ka dyan ng anong tawag dito, bakit kaya tayo napunta doon? Nawala ako. Bakit nga ba tayo napunta doon? No? Anyways, you have there your hyperkalemia. Oh, tama-tama yung compensatory mechanism. No? So your kidney will then try to decrease the urine output my times then na nagkakaroon ng renal insufficiency because of your hypoxia. Okay, ayan. And during the diuresis phase, no, meron tayong tinatawag na diuresis phase, gumagana na yung kidney natin, so there will be an increase in the urine output. Magkakaroon din tayo ng hypokalemia dyan. Okay, depending on the phase, okay, your hypokalemia and hyperkalemia will occur talaga. Okay, aside from your hypocalcemia. Kuha natin. Ayan. So dito din, there will be an increase in the viscosity, increase ang peripheral resistance. Pag mag-increase ang peripheral resistance, your heart or your cardiac output will decrease. Bakit? Kasi napapagod yung heart natin eh. Okay? It will now try, parang nahihirapan siyang mag-overcome sa peripheral resistance that your arteries or that your blood vessel is giving the heart. Kasi magtataas yung ating mean arterial pressure, yung mga arterial pressure natin. Kasi increase ang peripheral resistance eh. So that resistance should be overcome by your heart. Dapat mas mataas pa talaga yon. Okay? So what happens here is that decrease ang urine output and then there will be decreased oxygen levels going to the brain. Magkakaroon pa rin tayo ng hypoxia. Okay? So importante talaga yung hypoxia natin dito. Kaya O2. Okay, you have there your O2 kaya ginabigyan din yan sila ng O2. Okay? Kung mataas talaga yung extent ng damage. Okay. Ayan, systemic physiologic changes with burns of more than 25% of total body surface area. Okay, this is total body surface area. Okay, TBSA. Okay, ayan. So the change, so you have there the stages. Ito yung mga stages natin, hypovolemic stage. And then after your hypovolemic stage, you have there 24 to 72 hours. So your 1 day to 3 days. Okay, and of course, your diuretic stage. So ano ba yung nangyayari dito? Okay, first, okay, these are the changes. Okay, ano tawag dito? So you have there your ECF shifts. Ito yung mga changes na nangyayari. You have the extracellular fluid shift, no, vascular to interstitial. So nagkakaroon tayo ng edema. Ayan nga eh. Okay? So from your vascular or intravascular to your interstitial, nagkakaroon tayo ng edema. Nagkakaroon din tayo ng hemoconcentration. Kasi bakit? Okay? Remember sa ating hematocrit, no, kaya nagkakaroon ng hemoconcentration, so mataas, expect that the hematocrit will rise. Okay, when the blood is being drawn to the patient or from the patient. Okay, bakit? Remember class again, 'di ba yung blood natin, yung blood kasi nga we're talking about the vascular. Anong laman ng vascular mo? Dugo. Samok. So you have there the blood. 'Di ba yung blood natin? Oh, ayan, plasma. Okay? And then 90% of your plasma is your water. Okay? And these are your formed elements. Balik-balik na lang din sa class. Okay? Plasma, 55. 45% naman sa ating formed elements. Okay? Now, ito yung laman ng ating blood vessel. Okay? Now, this part here, yung plasma natin, okay, ito yung mag-shift. Okay? The part of the plasma will be the one shifting to the interstitial or doon sa extravascular natin kaya nagkakaroon ng edema. So here, your blood will now be concentrated. Mas marami na ngayon yung ating formed elements compared to your plasma. Kaya tumataas yung ating hematocrit levels. Kuha natin. Remember that your hematocrit is basically describing yung percentage or ng volume ng inyong red blood cells compared to the whole blood. Okay? Ayan. So there will be hemoconcentration at the affected site. Ano pa? Renal function natin, there will be decreased urine due to decreased blood pressure as well and cardiac output. Okay, so bababa yan sila. Okay, that is your hypovolemic stage. Kasi nagkakaroon ng hypovolemic, this is their way of compensating. Okay, nagdi-decrease ating urine output. Okay, now next is you have there ang result niyan ng decreased urine output, you have there your oliguria. Okay, and next, you have there your sodium, okay, trapped in the exudate or edema. So magkakaroon tayo ng hyponatremia. Sir, bakit magkakaroon ng hyponatremia? There is shifting nga eh. Remember, piso. No, piso. Sodium outside. Okay? So naadri ang imong sodium. Apil na siya sa imong plasma. So aside from the water, mag-shift din yun sila doon sa labas kasi you will be having your leaky capillaries already. Kaya nagkakaroon, kaya tinan mo, trapped in the exudate or edema. So kasali yan sila doon sa pag-shift. Okay? Next, for your diuretic stage natin, you have the interstitial to your vascular. Okay? Kaya nga nagkakaroon ng diuretic stage kasi bumabalik na. Okay? So magkakaroon ngayon ng hemodilution. Okay, so from the interstitial going back to the vascular, so what do you think will happen here? There will be an increase in the blood volume. Okay, now increased renal, so magkakaroon ng increased blood volume, so magkakaroon ng increased renal blood flow, thus there will be increase in urine output, magkakaroon tayo ng diuresis. Kaya nga tinatawag din siyang diuretic stage. Okay, this stage here siguro nakuha na yan siya. Anong tawag dito? Treated na eh. There is already a management being given to the patient. Okay? So, anong tawag ito? Your sodium, magkakaroon pa rin tayo ng hyponatremia dyan. Okay? Because it is lost in your diuresis. Okay? So, that is the reason why may times na, remember class, no? Remember nyo talaga ito. Pag sinasabi nating burn, ang ginagamit talaga na solution dyan is yung lactated ringer solution natin. This is your LR. Okay? What LR? Yung plain LR natin. Isotonic crystalloid. Okay? This is your isotonic, no? Na fluid na solution. So, plain LR tayo. If ever walang plain LR, your next solution there is your plain NSS tayo. Okay? Yung 0.09 sodium chloride or that is your plain NSS. Okay, that is your isotonic pa rin ito. Pero if ever meron na silang makuha na plain LR, ibabalik nila or i-change niya yung plain NSS to your plain LR. Remember that your plain LR also contains your sodium. Okay? Ayan. So, next is ano pa? Ito pa. Lipat natin ito dito. Ayan. So you have there yung potassium level natin. For the hypovolemic stage, there will be cell injuries. Okay, remember, di ba yung potassium natin, piso, potassium inside. And remember, cell injury. So magkakaroon ng bursting yan kasi nasunog eh. So there will be cell injury, marirelease yung ating potassium. There will now be hyperkalemia. Okay? At yung sabi ko sa inyo that may specific stages sa ating burn wherein magkakaroon or the patient will experience hyperkalemia and then the patient will experience hypokalemia. Dito na yan sa ating diuretic stage. Okay? So the result during the 48 to 72 hours, magkakaroon ka ng hyperkalemia. And then in the diuretic stage, malolost yan siya or malolose natin yung ating potassium. So stabilize after 3 to 5 days, the result would be hypokalemia. Okay? Ayan. So alam niyo na kung bakit may build-up of hyperkalemia because of the cell injury. Once there is a cell injury, bubukas or mamamatay, magkakaroon ng apoptosis yung ating cells and then lalabas yung kanyang potassium. Kasi ito yung nga eh, your potassium is the major cation inside your cell. Kaya siya lumalabas. So magkakaroon ng hyperkalemia dyan. Okay? Next, protein balance natin sa hypovolemic stage. There will be escape from poor vascular integrity and trapped in the interstitial space. Kaya din nga, this one here, or itong explanation na ito, it will also give rise to, anong tawag ito? It will also give rise, or it will add up to the shifting of your fluids from the intravascular going to your interstitial. Bakit? Kasi remember, your protein such as your albumin helps in maintaining the oncotic or the colloid oncotic pressure or your osmotic pressure sa intravascular ninyo. Sila yung humihila ng inyong fluids, no? From the interstitial going back to the intravascular. Eh sila din mismo yung pumupunta doon because of your cell injury. Okay? Kaya, or from the poor vascular integrity. Kaya nga, poor vascular integrity nga kasi may damage na kasi nagkakaroon ng leaky. Leaky na yung capillaries ninyo kaya nag-escape sila doon. Even though the proteins are too big, no, to be filtered. No? So lumalabas na yun sila. So you have their low negative nitrogen balance, and then there will be continued catabolism. Kaya dito, ang nangyayari dyan, malnutrition. Okay, kaya tinitingnan din yan nila. Okay, next is your acid-base balance. You have your anaerobic metabolism. Remember class, nasunog ka. Okay? You were, ano tawag ito? You were injured and then you inhaled maybe your carbon monoxide. So maybe your lungs were compromised as well. Okay, so hindi ka na masyado nakaka-inhale ng for severe kasi more than 25% ito. Okay? So there is a problem already with the inhalation of your oxygen. So remember, 'di ba, yung ating lecture regarding your anaerobic respiration. Okay, and your aerobic respiration. Okay? Aerobic respiration natin, both of them utilizes glucose. Okay? Both of them utilizes glucose. It's just that dito sa ating aerobic respiration, you have there your oxygen and your glucose, okay, which will of course produce your carbon dioxide, your water, and your ATP. Okay? Sir, again, bakit nga ito nangyayari, itong anaerobic and aerobic respirations natin? For cellular metabolism. Okay, for your body to work, no? Your cells need to metabolize, okay? For it to provide ATP. Okay? Remember, itong anaerobic and your aerobic will provide ATP. Itong aerobic natin, it will give you or it will yield large or sustainable ATPs. While yung anaerobic natin, ATP cute, gamay lang na siya. Okay? So ayan, sir, anong connection dyan? Of course, hindi na kaya ng katawan natin or hindi na kaya ng katawan natin to sustain your aerobic respiration. That is why they will be now going to your anaerobic respiration. And remember, the byproduct of your, or the, I'm sorry, not the byproduct, the product of your anaerobic respiration is your lactic acid. Okay? Aside from your hyperkalemia, okay, magkakaroon din tayo ng build-up of your lactic acid that would involve or that would also add itself doon sa ating acidosis. Okay? So anaerobic metabolism related to hypoperfusion, decreased renal function. Ayan, metabolic acidosis tayo kasi ang problema natin yung isang kidney. Okay? So you have there your metabolic acidosis plus yung hyperkalemia pa natin. So you have their metabolic acidosis, yes. Tapos sa ating diuretic stage, you have there your bicarb lost in diuretics or in diuresis, increase acid and products, so magkakaroon ng hypermetabolism. It would still lead to your metabolic acidosis. Okay? So categories of burn, you have there your mild, moderate, severe, and other criteria. For your mild, you have there the partial thickness. Tinatawag natin partial thickness. Kaya nga naririnig niyo sa mga TV series na mga ER, okay, or trauma, okay, pupunta sa ER, okay, with partial thickness of 15% or depending na lang kung ilang na compute sa TBSA, or full thickness burn, okay? So you have there less than, pag mild, it should only be less than 15% of adult, okay? Pag sinasabi natin partial thickness burn, ano tawag dito? It will just involve some layers of your skin. Etong full thickness burns talaga, okay? sunog lahat yung yung layers ng skin mo. Okay? Kaya as you can see, pag sinasabi natin mild, if you're going to compare your partial thickness to your full thickness, mas malaki talaga yung ating partial thickness kasi that means that mild man ito. Okay? And this is full thickness burn. Okay? So this is less than 2% in adult, no, pag full thickness burn. And for your moderate, it is what? 15 to 25% total body surface area, full thickness natin 2 to 10%, no? And then plus minor category criteria. Ano ba itong mga minor category criteria? They're now going to consider yung mga comorbidity natin. Okay, kung meron ba tayong iba't ibang sakit din or other sakit, okay, na nasa patient natin. Okay, these are what we call your minor criteria or category. Next is for the severe. Ito na yung ating more than 25% of your TBSA. And then full thickness burns are 10% in your TBSA, and burns are accompanied by other injuries and presence of other criteria in the previous categories. Okay, accompanied by other injuries such as, let's say, for example, fractures. Okay, pwede sa ating limbs, pwede sa ating thorax, okay, fractures, pwede din sa ulo. So you have there your head injury as well, no? Fractures, head injury, ayan. Okay? And for the other criteria, does not involve the eyes, the ears, the nose, the hands, the feet, and the perineum. No electrical burns or inhalation injuries, adult younger than 6 years old, and no pre-existing disease and other injury with the burn. Okay, ayan, mag-break muna ako kasi nauuhaw ako. Okay. So this is the classification of your burn. Baka malito kayo kung ano yung bakit partial, what is partial? What is included in the partial thickness burn? What is included in your full thickness burn? Okay, so ganito yun siya. The thickness, okay, you have there the superficial. Pag superficial lang, this is your first degree burn. It just include your epidermis, okay? Pag partial naman or superficial, there are times wherein wala na ito. Okay? Pag sinasabi natin partial thickness burn, that is already your second degree burn. Yun ang talagang isipin nyo, class. Pag partial thickness, that is your second degree burn. Okay? Ito yung pinakamasakit. This is the most painful burn there is, no, according to the classification. Sige, punta natin rin. Most painful. Sir, bakit hindi yung third, ano tawag ito? Third degree burn or your deep partial, okay, na thickness? It's because of the fact that, remember, okay, you have there your nasunog na rin kasi yung ating or na-damage na yung ating mga um aside from the blood vessel, you have there your nerves. Okay? Dito, okay, meron pang iba na injure lang. Okay, buhay pa sila. So masakit talaga yung ating anong tawag ito, yung ating partial thickness burn. Pero sir, during treatment, bakit sila sumisigaw? Of course, you have there yung burned area, tapos sa baba nun is the healthy area. Okay? That's why we need to debride or we need to take out yung scarring or yung damaged area so that there will be regeneration, no, of your or para ma ano tawag ito, it would improve the healing. Okay? Kasi if ever hindi natin tatanggalin ito, hindi natin yung lilinisin or tatanggalin, anong mangyayari dyan is that hindi talaga or there will be decrease in the healing potential. Charot, healing potential talaga. Healing of your tissues. Okay? Sir, bakit masakit pa rin? Of course, meron ba yung mga underlying nerves din natin doon sa baba pa? So nakadikit yung tissue, okay, yung burn na tissue doon, and then you're going to remove that, eh masakit talaga yun. Okay? But when we're talking about the most painful, ito yung dito. Okay? Painful din itong third pag nililinisan na or pag tinatanggal na yung mga debris natin doon. Okay? So you have there sa second degree because you have there the epidermis and the dermis or the dermal layer. Okay? So you have there the pain, blisters, splotchy skin, severe swelling as well. Sa deep partial natin or your third degree burn, ito naabot na sa reticular region. Sa full natin, sunog na talaga yan. Okay? So charred yan siya. So you have their charred, insensate, eschar formation. When I say insensate, wala ka na nasa-sense talaga. Okay? As you can see here, it is painless din eh. Relatively painless. Pero paglinis niyan, masakit pa rin yan, class. Okay? I would like to, or I'm going to show you siguro a little bit of clip mamaya sa sakit talaga Okay, I think there is a wonderful burn unit kasi dito sa ating SPMC. It's like one of a kind for the burn unit kasi na-develop talaga nila. Okay? Ayan. So let's talk about determining the burn severity. Okay, factors determining the burn severity. Of course, the burning agent or cause. We have there the chemicals, electricity, di ba, the flame, okay, or yung heat natin, the location or body parts. So meron tayong tinatawag na rule of 9, which mapapakita ko mamaya, the age. Okay? Remember class, this now, kung if you really, kung meron talaga katutunan sa fluid and electrolytes, okay, remember 60% of that one is water. Okay? And this is for the adult. Diba yung sabi ko sa inyo, as you grow older, bumababa din ito. Pero pag ikaw bata ka pa, of course, this 60% is higher. So kung mas bata yung nasunog or nasunugan sa ng katawan, of course, it will determine talaga the severity. That means that mas marami ang malulose na water ng bata compared to an adult who experienced burn as well. If ever they have the same TSBA. So if you're going to compare, let's say for example, 15% TSBA of an adult and 15% of TSBA of a child, mas marami yung nawalang water doon sa child kasi nga mas mataas yung kanilang water content sa katawan. Kuha natin. So age explained. You also have the depth of burn. Ito yung ating degree of burn. Okay? Degree of burn natin kung superficial, superficial na partial, superficially partial. You also have there your deep partial and your full partial. Full tapos partial. Sorry, full thickness pala. Full na partial. Oh, meron din akong ganun. Lutang moment sa OR. Sa operating room when I was a student. Yatay dito. Because I remember, sabi ko full partial, di ba? Full na partial pa talaga. Okay. I was like counting kasi kina-count talaga yung instruments no, para walang maiwan doon sa baka may naiwan na needle or suture doon ba? I mean the needle with the suture doon sa loob, bawal 'yun. And baka may naiwan din ng mga OS sa loob ng abdomen or depende kung saan nag-open no nag-explore yung ating surgeon. Okay? So nag-count kong instrument. Okay. Straight curve clamp or straight curve sa bato nga katong murag tig hold or clamp or something. Straight, one straight ano gutong surgeon. Straight na curve pa ano nabitaw no. Lutang moments. Ano ko my god. Kunya ang anesthesiologist pa dito is like pinsan ko pa talaga no. Tibugo yaw. Makapamalikas na lang yun ka. Okay. The size of burn, this is now your TSBA. Okay? Still, no, location of the body parts kasi sa rule of 9 natin, there is a body part doon na wherein mas mataas. Okay? Mas mataas yung percentage na ina-allocate doon na area. I will be showing you that one. I think some of your clinical instructors already showed you this doon sa integumentary system sa ating anatomy and physiology. Pero kung wala, don't worry, I will be showing that one to you. Okay? History of cardiac, ito na yung ating mga other categories. Okay? Kasi if ever there will be history of cardiac, pulmonary, renal, hepatic disease, of course, mas complicated yung management niyan. Okay? Kasi they will be thinking of, okay, yung kidney may problema, yung lungs may problema, your heart may problema. Okay, so there will be an added management for that one. Injury sustained during the burn injury as well, yung mga fractures natin. Okay, fractures, head injury, yung mga ganyan na bagay. So that is basically trauma. Okay, physical trauma. Okay, burning agent and location, let's talk about that one. The higher temperature of the burning agent and the longer duration contact can cause more severe injury, yes. So burn sustained in the head, the neck, and the chest is associated with higher mortality rate because of ito, number one, bronchoconstriction. Secondary to histamine release causing edema. Guys, histamine, inflammatory. This is part of your inflammatory response. Okay? You also have your carbon monoxide poisoning. Okay? Secondary to smoke inhalation. So, mas una ka talaga mamamatay niyan compared or merong iba kasi yung na-trap, no? Na remember ko yung pag-uwi ko rin before ako na accident din. There was this incident in NCCC. Grabe luya, oy, kanang yung mga call center agents doon, some of them were trapped talaga. Okay? Sana para hindi lang talaga nila maramdaman yung pagkasunog nila, no? May their souls rest in peace. Okay? You get kuan magod, you lose your consciousness magod whenever you inhale yung mga carbon or if you ever you will be experiencing carbon monoxide poisoning. Okay, so you will be unconscious, and then yun ang usually ikinamamatay ng mga patients na ayun nga nasunog. Okay, kawawa po, grabe yung NCCC na yun, no? Paluoy sa mga, and then padulong ba ito Christmas, and then ako pagka New Year patay pud ko. Okay, ayun, aksidente ako. Chest constriction secondary to your circumferential burn. Bakit nagkakaroon ng constriction? Because remember of your compartment syndrome. So nakala ko ba sa limbs lang yan? No, no, no. It's not just only in the limbs, no. Anywhere in your body. Okay, compartment syndrome. Kasi mag-i-inflame na yung tissues natin eh. Okay, so pwede rin sila gawa ng incision dito sa katawan mo. Okay? Burn sustained in the perineum area requires special care. No? Risk for infection yan siya dyan for the perineum area. Pero pag sa perineum natin class, ang binibigay natin na percentage dyan is 1%. Doon sa ating rule of 9. Okay? Ayan. So these are the types of burn injury. Okay, you have your thermal, chemical, electrical, and radiation, and the causative agent as well, and the priority treatment. So this is just going to be a added or for your consumption din. Okay? Yan. And napakita ko na pala. So na-discuss ko na ito, no, yung ating the age, the depth, the size, and size of burn. Ito siya. Ito yung ating depth, no, yung depth natin and the size of the burn. Okay, yung age wala pa dito. I'll be showing you the age later. Okay, so you have there the first degree, second degree, and third degree. Ito nga yung sabi ko sa inyo, it is very painful yung second degree natin. Remember, if you can remember, kung tatanungin ko kayo, ano ba yung tawag sa ating second degree? Okay, this is superficial, di ba? Superficial. Second degree natin, that is basically your superficial na partial. Superficial, partial. Okay, and then your third degree, you have there your deep partial. Okay, kuha natin. So these are the symptoms as well, still presented on the previous slides, and the action plan. Walang problema talaga sa first degree burn, no? So you have just to run or soak the affected areas in cool water for 5 to 20 minutes. Do not use cold water or ice baths. No, wag po. So yung kuan lang, tap water, no? Cool water, no, gikan sa gripo. Okay? Because remember that if you're going to use cold water or ice baths, mag-vasoconstrict yung ating mga blood vessels dyan. Okay? And cover with an appropriate dressing, clean the wound, and change the dressing every day. Okay? Kanang napaslo, tapit po na. Okay? And you also have here the action plan for your second and third degree burn. Ayan. History of your cardiac, pulmonary, renal, hepatic diseases, and injuries sustained during burn. So what are we going to, or what are the things that we need to consider? Okay, pre-existing, remember that pre-existing disease conditions would reduce normal compensatory mechanisms. That is why sabi ko nga sa inyo, there is a special management for persons na mayroong mga comorbidities. Okay? Kasi mas complicated yung case nila when it comes to, if you're going to compare it with the person who does not have any comorbidity, of course, there's a lot of considerations man good that you need to consider dito sa ating mga patients na may comorbidity compared to the person na nasunog pero walang comorbidity. Kuha natin. Optimum systemic functioning is very vital for the burn client to respond to the burn management, such as fluid resuscitation. Sir, ano ba yung mga special na sinasabi mo? You're very general. Let's say, for example, yung mga, remember, burn tayo, fluid resuscitation talaga yan. Okay? Let's say, for example, TSBA of more than 25%. Severe naman talaga yan siya. You have to consider, let's say, for example, kung meron siyang heart condition or meron siyang congestive heart failure, dili kayo ka pwede mag-aggressive anak. Okay? Because remember, meron siyang congestive heart failure already. Okay? So, computed talaga yung pagbibigay ng ating fluid resuscitation. Okay? Injuries sustained and nutritional correction and infection prevention. Injuries sustained during burn injury like fractures requires prolonged hospitalization and additional management. No, ito na yung sabi ko sa mga trauma, no, yung mga added injuries doon. Head injury, any trauma injury talaga. Okay? So hindi ito siya, when we're talking about injuries, these are not comorbidities. Ito yung nag-develop yan siya, or the reason why nagkaroon yan in comorbidities. Okay, it's not talking about the comorbidities, ha? Kasi nangyari yan siya because of the accident. Okay? Stages of interdisciplinary care, you have the clinical course of treatment for the burn patient are divided into 3 stages. I will be showing you the 3 stages mamaya. Okay? You have there the emergent phase, tapos meron tayong rehabilitative phase, and yung diuretic, if I'm not mistaken, it's your diuretic phase, no? Pero sige lang, if I'm wrong, then sige lang, i-correct lang natin. It's on the next slide man din. So clinical course of treatment for the burn patient are divided into 3 stages, and these stages are useful to determine the clinical needs of the patient. Ano ba ito sila? Ayan. So you have there, tama lagi ko. Mali talaga. Dapat acute yun. So you have there your emergent, sabi ko kanina, or your resuscitative phase. Okay? Or immediate resuscitative phase. You also have there your acute, and you also have there your rehabilitative. So you have here ear. Okay, para hindi kayo malito sa phases. You have there the ear, emergent, acute, and rehabilitative. Okay, or your rehabilitative. Rehabilitative. Whatever. Rehabilitative. Rehabilitative. Tama naman. Tama naman. Confuse mo lang sarili mo, sir. O, sige na. Emergent or your immediate resuscitative phase, the duration of this one, you will know that this phase, or how will you know na emergent phase yan siya? It is the onset of injury to completion of resuscitation, okay? 48 to 72 hours or 2 to 3 days, okay? So you have the 0 to 3 days tayo dito sa ating emergent, okay? So the priority is for your emergent kasi emergency ito eh. So you have there the first aid. Remember yung first aid natin. A, B, C tayo dyan. That means you have there your airway is the priority, breathing, and then circulation. Pag unconscious yung patients natin, there are times we're in, yung updated natin, CAB na tayo. Okay, you have there the circulation, airway, and then breathing. Okay? So prevention of shock. So is first aid ang gina-prevent natin yung shock dito. What kind of shock? May it be hypovolemic shock. Okay? Or pwede rin hemorrhagic shock. Though, of course, yung hemorrhagic shock natin, it will also turn to your hypovolemic shock kasi mababa yung blood volume natin eh. Okay? So you also have their prevention of respiratory depressed airway, detection and treatment of the injury. Second talaga yan, class, ha? Ayaw ninyo, 'di ba, sa ato ang BLS or your basic life support. Okay? Assess the area talaga yan. Yung sa mga Red Cross, 'di ba? Assess the area or site survey. Do a site survey. Pack. Okay, make sure that the area that you are with the patient or with the person who experienced the accident, okay, is in a safe place. Pag hindi safe yung lugar, of course, dadalhin mo yung tao, you can drag the person while immobilizing, yung maganda na pagka-drag, while immobilizing yung kanyang spine para baka to prevent further injury. So ipapalayo mo yan siya doon sa danger site. Okay, so site survey tayo niyan, then check for the check tuloy. You're going to ask, hey, are you okay? O, di ba? Mas dili na good, okay, good. Pero what you're trying to check there is if ever the patient is conscious and if the patient is, anong tawag dito? Conscious and nakakahinga siya. Kasi kung magsabayan siya, I'm not okay. O, di ba? Alam mo na you're going to do a further assessment. Okay? Kasi yung conscious yun siya, okay pa yun siya, tapos coherent, or you can always go to the other patient or to the other person who experienced the accident as well. Okay? Tapos yung nahihihi mo, okay, pag hindi mag-respond, you're going to check for the breathing and for the pulse. No? Maganon ka man dyan. Breathing and check mo yan dito. Slide mo yan while you are also check mo. Okay. Okay. Sa rasa man mo ibutang, of course, dito sa ihang kuan, baba, kasi you will be observing the rise and fall of the thoracic area of the thorax of the patient. Okay, anterior thorax. Ayan. Detection and treatment of injury. After that one, pag ma-stabilize mo yung airway na yan and the breathing, ito na, and the circulation, okay, you're going to apply bandaging already if ever meron tayong bleeding sa other parts of the body. Kaya nga circulation Okay, wound assessment and initial care. For the acute naman, beginning of the diuresis, okay, to need completion of wound closure. So wound care and closure, prevention of treatment, of complication, and nutritional support tayo. Dyan ang priorities natin. And rehabilitative from the major wound closure to return of individuals optimal level of physical and psychosocial adjustment. Okay? Lisod kayo pag masunog imuhang naong class mo na siya ang pinakalusod. Magka-scarring kanyan. So, you will really have to undergo a lot of surgeries. Mga plastics natin dyan. You have your plastic surgery, no? So, magkakaroon pwede din yan. Option dito, skin grafting. Okay? Kuha ka ng, ano tawag dito, part of your skin doon sa ating buttocks. Okay? That is an option. Prevention of scars and contractures. Ayan, ito na yung mga constructive surgeries natin, no? Mga anong tawag nito? Ay, nakalimutan ko yung term. Basta it's a term they use in the plastics, no? Plastic surgery. Physical, occupational, vocational rehabilitation para you're trying to increase the optimal level of functioning of the person. Even if hindi na niya ma-return to 100%, you're trying to achieve na matpataasan pa. Okay? And functional cosmetic reconstruction. Ayun, reconstruction pala yung tama. And psychosocial counseling as well. So these are the priorities in each of the phases. So for the emergent or resuscitative, okay, ito yung ating nangyayari sa management natin. You have there your pre-hospital care, emergency care for minor burn, and emergency care for your major burn. Okay? Ito yung sinabi ko sa inyo, remove the person from the source kasi nagsa-site survey ka. And then nakita mo, uy, baka masunog din ako dito. So of course, ilalayo mo talaga yung patient. So dito napapasok yung mga BLS natin, yung basic life support natin. No? Assess ABC trauma. Okay, nasabi ko na yan, cover burn with sterile, clean cloth, and then remove constricting clothes and jewelry transport immediately. That is why in some trauma cases, class, no, kung itong mas hindi burn, okay, ginakat talaga nila yan using your bandage scissors. Okay, ng mga clothing or that the clothes that would restrict, no, any access or limit the access, no, for further assessment of the trauma team. Okay, emergency care for minor burn, you have there to administer pain medication. Yes, administer tetanus prophylaxis as a prophylaxis yan siya, ha? Okay, and then wound care, and then apply topical antibiotics. Okay, so meron din akong we have here a common treatment for that one, yung cream natin that is also applied sa akin, yung sa likod ko. Sir, meron ka ba naramdaman nun? Wala. Okay? Kaya yun nang ganun kasi wala na rin siyang naramdaman sa akin. Humugot. Of course, that was the past. No? Yun. Eh, chika ko lang yan sa inyo. Sa live, no? Mas maganda sa live discussion. Okay? So you have to apply topical antibiotics for that one. Meron tayong cream dyan. Okay? Next, emergency care for major burns. Evaluate the degree of burn by yung ating rule of 9. Okay? If you will become a paramedic, no? Kung yung mga 911, kayo yung tinatawag, kayo yung to the rescue. Kasi kayo mag-e-endorse para meron silang idea on the condition of the patient, or the status of the patient. Okay? Establish patient airway. Yes, nasabi nga ito, administer oxygen for burn victims in the enclosed area. Venoclisis. Pag sinasabi natin venoclisis, this is what? Opening an IV. May it be peripheral or central. No? IV line tayo dito. Starting of your IV line, peripheral or central tayo. Maintain NPO and insert NGT, no, if needed naman, no? Kasi major burn ito eh. If needed, major burn na nga yan siya. Needed talaga yan sa class. Okay? Insert NGT. I'm sorry. I thought this was a general care, no? So insert NGT, insert Foley catheter as well para ma-monitor talaga natin accurately, no, yung ating urine output. Kasi ako, ano tawag ito? Di ko ganun magpasulod og kuan urinary catheter because hate jud na ako na siya. No, I don't want to return to that experience anymore. Okay, kahit yung kukulo, I even bargained for the doctor na kung makaihi ko, dok, di ko nimo paslakan ani ha. Oh my god, toxic ako yung that time. Syempre, BUN Crea, sige sulod-sulod sa utok. Mo nang langas kay mga utok ng mga na ay mga renal failure class, no. Okay? Ayan. So, Foley catheter yan. Kaya pala. Okay? for the output, no? Kasi makikita mo dyan yung, uy, okay, diuresis phase na siya, dapat you're expecting na magtaas yung urine output. Okay, na siya sa hypovolemic stage. Okay? So, dapat mababa yung output niya. And then, of course, treatment managers will be given. So, you will be expecting na, okay, tumataas yung kanyang urine output. Pag diuresis phase na tapos kuan, diba, diuresis phase is after 3 days, no? After 3 days of management, no? Or 72 hours. Kita mo, wala man gyapon ni siya nagtulo or wala man gyapon ni naga-improve ang iyahang urine output. There's a problem with the kidney already. Okay? Kaya mo siya gina-monitor. Okay? That is why in the diuresis, ayun yung mga expected mo na doon. Expected mo na yung mga results na mag-increase yung urine output niya. Okay? Tetanus prophylaxis and give pain medications. Okay. Sa emergent or resuscitative phase pa rin, okay, fluid management is one approach to treat the burn patients. Yes, of course, within minutes of burn injury, massive amount of fluids. Ito yung shifting natin from the intracellular going to the intravascular compartments to the interstitial. Okay, again, from the intracellular going to the intravascular. So there will be an increase, no slight increase, not really slight, no, there will be an increase in your intravascular. Pero that increase in your intravascular compartment, it will not last long kasi mag-shift sila from the intravascular going to your interstitial. Kuha natin. Ayan. So this is the computation of your BSA or of your body surface area or your total TBSA natin. Total body surface area. Extent of burn injury size is expressed as a percentage of the total body surface area. Yung sinasabi ko kanina, TBSA, TBSA. Methods, rule of nines tayo dyan. Sir, bakit naging rule of nines? Because all of them are 9 or most of them are 9 and they are divisible by 9. Okay, kuha natin. So you have here, okay, you have here sa head natin, 9 yan siya. Okay, sa ating anterior thorax, that is 9%. Thorax tayo ha, this is the region. Head and neck tayo dito, this is your head and neck, 9%. You have there the anterior thorax, which is your 9%. Your abdomen, which is your 9% naman. Anterior, ito siya, this is your anterior. Iba-iba ha, iba to siya, anterior. And this is now your posterior. Okay, so 18 lahat dito. You have there the thorax, the abdomen, the posterior thorax, and the posterior abdomen or your lower back. And for your arms naman, the anterior portion of the arm, that's 4.5. Pag apil ang likod, another 4.5. Okay, so magiging 9 pa rin yan silang dalawa. For your perineum, that is 1%. Okay, sir, what if dako kayo ang bunal? BBC. Will it affect? Sir, nabay difference kung BBC or kung tender juicy hotdog na cocktail or tidbits. Tidbits, di ba kuhan man na, sir, ka naman sa uh, sa fruit ka ng dilat, dili tidbits, sorry. Cocktail. Di ba no, cocktail? Okay, so no, it will still be 1%. Sir, sobra, grabe na mag-imagination na ayaw na. Ako pala yun, no? Ginabigay ko sa inyo yung imagination na yun. Pero so who knows, no? Baka basig mangutana mo, ana. Okay. Now, you also have here your anterior natin, 9%, and you also have there the posterior 9%. Okay? If you're going to total this one, that would make up 100% po yan. Okay? Yan. You try ko compute class kung 100%. Yes, it is 100%. Kung na-compute ninyo 91, nakalimutan ninyo, this is another 4.5 and this is another 4.5. Okay. So, this is just an approximation plus estimation lang talaga. The estimation of the burn size. That does not necessarily mean kung 9%, 9% talaga yun. That is just an estimation. Okay, kasi since it is involving the head, ayan, 9% na yan siya. Okay, so that is the rule of nines. So you have here your Lund and Bowder chart for assessment for your pediatric burns. So lahi jud ang computation sa inyong pedia. Okay, so ito yung ating rule of nines pa rin dito. 18 sa leg natin H because you have their 9 sa anterior, 9 sa posterior, 9 anterior, 9 posterior pa rin. Okay, 9 kasi 4.5 each. Ito anterior and posterior, 4.5 ang anterior and posterior. So this is for your pedia. Okay? So ayan yun siya yung pedia natin. So you will be having anyway, so you'll be having your cheat sheet naman din okay, to compute for your TBSA. Okay. Now, the common formula, paano ba itong management or fluid resuscitation? Ito ang very important. Remember, class, di ba yung sabi ko sa inyo, lactated ringer solution. Okay? Ang ginagamit dito, specifically your plain LR. Okay, ito talaga yung number one. Okay, number one. Kung wala ito, number two natin is your plain NSS. Okay? These are all isotonic. Okay? Most of the time, dili na mohatag og hypotonic ana kay makuratan ang inyong cells ana. There will now be ano tawag dito? Mabilis ang pag-shift ng fluids nyo from the extracellular going to your intracellular. And that's what that's not what we're after. Remember that your isotonic is a volume expander as well. Okay? Mas makokontrol nila ngayon yung pumapasok or lumalabas na or yung movement ng ating tubig or ng fluids natin. Okay? That is for your fluid resuscitation. And remember, class, that the burn patient, dehydrated na yung ating cells doon. So, makasulod yun gihapon ng isotonic ninyo. Aside from that one, aside from the resuscitation, or aside from replenishing your dried cells, or yung ating dehydrated cells, it will also increase the blood volume. Okay? Ayan. So, fluid resuscitation, administration of the intravenous fluids to restore circulating blood volume during blood volume during the acute period of your capillary permeability kasi magkakaroon tayo yung leaky capillaries. No, this is now to prevent burn, shock. Okay, burn shock. Okay, or even your hypovolemic shock. Parkland and modified Brook formula, ito yun siya. Ito yung ating Parkland, ito yung ating modified Brook. Okay? Same lang sila. Both of them are using lactated ringer solution. Yung sabi ko sa inyo, LR solution ninyo. Okay? Pero nag-vary lang yan sila dito. Okay? So 4 ml tayo sa ating lactated ringer. Sa Parkland natin. Sa modified Brook, it's going to be 2 ml. Sir, paano ba yan? So of course, yung constant natin, this is your constant, 4 ml. Okay? Kilograms, pila ang timbang sa ato ang patient. Let's say, for example, 52 kilograms atong patient. Okay? And then total body surface area using your rule of 9. Sige, butang nato na siya 27% ang TBSA niya. Okay? So that is part of severe na yan siya, ha? Severe na yan siya, ang kanyang burn. So you're just going to multiply everything. Okay? 4 ml times 52 times 27. That means you have here 5,616 ml. Grabe po ng liter. Ubutang ang takong liter. Hindi. ml po tayo. Grabe po ng 5,000 nga litro. Buang na. Ma-overload yun ang inyong patient. So, 5,616 ml of your lactated ringer solution. How are you going to divide that one? Remember this one. Infuse 50% of volume during the first 8 hours. O sige. So, you have there 5,616. Now, during the first 8 hours, okay, you're going to get the 50% of this one divided by 2. So, that is, ang half nito, so you have there the half of that one, 2,808 ml. Okay? Ito yung 50%. This will run for 8 hours. Okay. Now, class, sir, makakuha ba tayo ng rate niyan if kung wala tayong ibang value? Yes, of course. Naman ka 8 hours ani to run. I-budget nimo ng 2,808 ml nimo to run for 8 hours. How are you going to do that? I-divide na nimo. 2,808 divided by 8 hours. That means 300 okay, ml per hour. Sir, di lagi may makita ana sa mga patient na ma-admit sa hospital because these are not burn cases, class. Itong 351 ml, this is a burn case. Okay? Alam nga, you do not expect them to infuse 351 kung dili burn ang case niya. Okay? 351 ml per hour na siya. Okay? And then that means pila ka drops depende. Okay? Kung bata to siya, I'm sorry, kung microset ang gamit, let's say for example, kung microset ang gamit, 'di ba remember the rate is already the drops. Okay? Kung microset, that would mean 351 drops per minute. Kabuang kang regulate ana. So you're going to count, no? Murag fast trip jud ni siya, no? Grabe. Grabe. Okay? So that will be running for 8 hours. Okay? And then kung macro set ito siya, okay? Macro set, and then considering that the macro set will have a drop factor of 15 drops, no? 15 drops yung kanyang drop factor. Okay, you will divide that 1 by 4, 351 divided by 4. Okay, ayan. 88 drops, no? 87.75, diba? Dapat kung drops round off na to. So that would be 88 drops per minute. Ayan. Okay. So, ito yung siya sa first 50. What will you do with the other 50%? So, yung ating other, this is now your second. Okay? Second half. Diba? Second half. So, you have there your 2,808. Okay? Will run for 16 hours. So, will run for 16 hours. So, if it will run for 16 hours, you're going to divide it again by 16. So, 2,808 divided by 16. Di ba? Mas nagbaba na. Kasi nga, sa first natin, very aggressive tayo dyan. Okay? 175.5 or, anong tawag ito? 176 cc or ml per hour. Okay, kung microset, that is 176 drops per minute. Pag macroset naman, tapos 15 drop, ang drop factor niya is 15 drops. So, 176 divided by 4, 44 drops tayo. Okay, GTTS per minute. Okay, ano lang siya. Okay, kuha natin. Ayan. So, early urine output is measured to determine the fluid resuscitation is effective. Ayan. So, you will be expecting na tumataas dapat yung kanyang urine output. Okay. Other interventions during resuscitative phase, yeah, they elevate the head of the bed 30 degrees if there is facial or head burns tayo dyan. Sir, bakit ba yan kailangan i-elevate? It's because of the fact that if it is not elevated, ang mas mabilis or yung daloy ng dugo dyan is mabilis compared kung naka-elevate. Sir, bakit ba natin pinapahinaan yung ating daloy ng dugo papunta doon sa burnt areas? Of course, you're trying to kasi andito tayo sa resuscitative phase, emergent phase ba ito siya, di ba? Your emergent phase is your resuscitative phase. Okay? So we are trying to prevent further shifting of fluids papunta sa kanyang head. Okay? Or sa kanyang face. Okay? Ayan. And you also have the elevate circumferential burns of the extremities with the pillow above. Again, ayun nga, yun ating kuan. Pinapahinatan yung blood flow papunta doon. No? Para sa, anong tawag dito? Para sa lessen yung shifting of fluids. Okay? Assess for infection, tracheal or laryngeal edema. Okay? Yung sa airway natin dito. Okay? Kung naghubag na. Protective isolation technique, shave hair around wound margins. Yes. Okay? Para mas malimpyuhan siya, and of course to decrease the ano tawag ito? To decrease the chances of having your bacteria stay in yung sa mga hairy parts natin. Okay? Monitor gastric output. and pH, no? Mali nga pH, dapat ano siya? pH for stress ulcer. Yung stress ulcer natin, that is your Curling's ulcer. Ito talaga din, i-remember nyo ito class ha. Basta stress ulcer gani, that is brought about, or yung basta magka-burn yung patient, they are at risk for having ulcers din. Okay, sa ating gastric organs, sa ating stomach, maybe sa stomach, sa ating intestines as well. Because of your stress ulcer or your Curling's ulcer. Ito talaga yung ulcer ng ating burn. Okay? Delete ng mga PUD na to. Ha? Administer anti-ulcer drugs or anti-ulcerative drugs. Yes, para ito to prevent this one. And then avoid IM and sub-Q administration. NPO until bowel sound is present, kung positive na yung kanyang bowel sound, and then monitor daily weights or daily weights ng patient. Remember, kasi fluid resuscitation tayo and then 60% of that one, 60% of our body's weight is considered to be water. Kung normal ka nga tao, normal to imong BMI, and you're an adult, and you're a male adult, okay? Acute phase tayo begins with hemodynamic stability, capillary permeability restored, and diuresis begins, okay? Primary concern, restorative therapy to wound closure and infection control. Okay? Kasi may times na dito sa acute phase, ayan, nagkakaroon ng kuan, or doon sa resuscitative phase or emergent phase, nagkakaroon tayo ng compartment syndrome. So, ino-open nila. So, from there, kailangan talaga sterile talaga yun. Okay? That's why may times na kung sa labas, makikita mo talaga the tear placed in the bubble, or meron talaga silang unit for the burned patients. Okay? You have there, okay, and sabi ko na, aseptic technique, okay, sterile technique, adequate debridement of the wound. Kaya every time talaga, no, kung labi nagbata, paliguan sa ilahang hyperbaric chamber, then sa SPMC, umiiyak talaga yan sila. No? Sakit kaayo na sa class. Okay, so kayo class, you have to be careful na hindi kayo masunog. Okay? Bahala na masunog mo sa pagmamahal, class. Pero don't play with fire. Okay, tetanus immunization. Yes, this is a prophylaxis, no? Para hindi magka-tetanus yung ating patient. Okay? IV antibiotics, topical antibacterial therapy, and you also have there your wound care, so dressing. Every day ako gina-dressing that time as well. So meron ding everyday application of your antibiotic na cream. You have there, ito yung ating mga surgical management. Your escharotomy, fasciotomy, and your hydrotherapy. Okay? Ito yung ating escharotomy. As you can see, no? Kung ano siya, na-burn na siya ng patient, na-burn na siya. Sir, kanong puti man kaayo, basta na-burn na siya. Okay, so they had to cut. Okay, as you can see, kung wala pa na siya na-inflame, dili dapat in-ani. Dapat straight lang yun na ang incision, ana. But as you can see, no, hubag ka. My God. Hubag kaayo ang iyahang tissues dito. Sir, tambok naman. Oh. Yes, fats na siya. Okay, so you have there the tissues just to etong mga, sorry, this escharotomy and fasciotomy, itong dalawa na ito, okay, this is to relieve pressure. Secondary to relieve pressure secondary to your compartment syndrome. Sipon ako. May allergic rhinitis. Ayan. And you also have there your hydrotherapy para malimpyuhan ang samad. Okay? Ayan. So surgical incision through the eschar into the subcutaneous tissues to allow extremity to continue to swell without compressing the underlying blood, because compression of your underlying blood will lead to your hypoxia. And your fasciotomy is a surgical procedure where the fascia is cut to relieve tension or pressure, commonly to treat the resulting loss of circulation to an area of tissue or muscle. Fasciotomy is a limb-saving procedure when used to treat acute compartment syndrome. Diba? Yung sabi ko sa inyo, compartment syndrome. Okay, so I'm going to pause this one muna. Okay, to show you the video ha. Hanapin ko muna yung video. Okay, I'm back. Okay, so I'll be showing you the video now. Let me just anong tawag dito? Share the sound first. Okay. And I'll be playing your escharotomy. Escharotomy.
See how it's
Okay, so as you can see during the incision, makikita nyo talaga na pag-slice pa lang, no, ng, or as the scalpel glides to the skin of the patient or is being incised, no, mubuka na jud siya. Okay? That means na grabe na jud ang pagka swollen sa inyong tissues dira.
unzipping. And it doesn't bleed like crazy.
But I missed the line. Oh yeah, that's good.
Got a pet? That's probably enough.
That's good.
That's it? Yeah.
Yep.
Sige no. Ginato to siya class. Okay, and let me show you another one.
Is done to allow the burned skin to flow to the hands and feet. Burn victims may suffer injury to any part of their body, but when the burns are circumferential, other problems occur. These patients are at risk for serious complications caused by inadequate blood flow to the hands and feet as the tissues under the burn swell. Unless escharotomies are performed at the appropriate time, the pressure in the arms and legs may rise to the point that blood flow is insufficient. Similarly, deep burns of the chest may also lead to respiratory compromise as the chest rise and fall becomes restricted. An escharotomy is an incision made through the eschar, or burned skin. This is done to allow the burned skin to spread apart and allow expansion of the underlying swelling tissues. Patients at highest risk are those with deep circumferential burns of the extremities or torso. The areas that are most problematic are the forearms, hands, lower legs, and feet. Once compartment syndrome causes ischemia, irreversible tissue damage may occur within 4 to 6 hours. Evaluation of burned extremities for rising interstitial pressures may be challenging. The awake patient may help by relating the presence or absence of symptoms caused by diminished oxygen delivery to peripheral tissues, such as numbness and tingling or deep aching pain. These symptoms may occur as early as 2 hours after injury. The classic signs of ischemia may be found in many burn patients with compartment syndrome. These include the 7 Ps: pain, pallor, pulselessness, paralysis, paresthesia, poikilothermia, and progression of findings. The obtunded patient is more difficult to assess. Non-invasive techniques for evaluating adequacy of blood flow include checking Doppler flow signals in the palmar arch and digital arteries. Warning: the presence of palpable pulses in the wrist or ankle does not guarantee adequate blood flow to arterioles or capillaries in the hands or feet. For example, radial pulses will not disappear until interstitial pressures exceed 90 millimeters of mercury, whereas capillary blood flow is stopped at only 30 millimeters of mercury pressure. The gold standard for
Okay, so ayun, yun po ay yung ating escharotomy na how do you call this? Na procedure. It is somehow the same with your fasciotomy, no? Okay, that means fasciotomy doon sa fascia na layer. That's where you're going to cut it. Okay? Yun nga, fascia. Sabi ko rito, fascia. Sayang ba, no? If maganda talaga sana class, no, if ever this would be a face-to-face. Kasi you will really see whenever a surgeon cuts through the different layers. I-explain mo yan na nila kasi meron yung mga interns, meron man din sila mga interns or residents who are observing. Okay, so sasabihin nila, so I'm cutting, ito na yung fascia. Okay, yan. So these are the antimicrobial agents. Ito yung ginamit sa akin, yung ating silver sulfadiazine cream. This is good for your negative and your positive. Okay, mga bacteria natin. Okay, gram positive and gram negative bacteria natin. Okay, you also have your muffinide acetate cream and your silver nitrate solution. Okay, I don't know if this is already phased out, yung ating silver nitrate solution. Kasi ang naan naman good sa aqua karon is your silver sulfadiazine cream. Okay. Anyways, if it's still here, that means that baka ginagamit pa ito. Okay, cream lang din siya. Sir, mahapdi ba? At that time, I was having, I think my nerves were also damaged because of your because of my rhabdomyolysis or rhabdomyolysis, I'm sorry. Ayan. So, hindi ko rin ma-feel any pressure lang talaga ang ma-feel ko. Pag ginatuslok og needle lang akong likod, no, I cannot feel anything about that one. Yung lower back ko, sa lumbar area. Okay, dito yung burn ko. So, this is being applied, no, for magaling to siya sa inyong negative and positive. Anong negative? Gram negative and gram positive ng mga bacteria natin. Okay, ayan. And the goals there, so pag mag-apply ka nito class, by the way sa akin, no, if you're going to apply, dressing pa rin yan siya. So, ang masakit lang talaga is the pagtanggal ng plaster. I don't know what plaster they were using, pero ang sakit. No, kasi merong may part doon sa likod ko na that develop yung mga blisters natin and yung ating vesicles. Okay? I don't know if may bula doon kasi it's too big na mga vesicles na siguro na maapil siya pilit dito niya pagtanggal ana because of course daily man yan siya. Sakit, masakit pilit. Malagot kayo. Grabe makautong. Anyways, I don't want to remember those, no? So for your rehabilitative phase, goals natin is to gain independence talaga. Kasi pa-discharge naman itong patient natin. Okay, gain independence, achieve maximal use of the affected part. If hindi maging 100%, okay, our goal there is to really maximize, no? Ang point dito sa ating rehabilitative is maximizing talaga. Maximizing what is left of the patient's capability. Okay? Ayan. Promote wound healing as well. Minimize deformities. Ano yung mga deformities natin? We have there your contractures. Okay? Increase strength and function and provide, of course, importante talaga ito, emotional support. Okay? Especially kung ang burn area is ang face, okay? Or if ever athlete yan siya, no? These series of changes magud sa ilang kinabuhi, it's new to them. And then para din sa akin kasi class, no, from bedridden and then from wheelchair, from walker, from crane, okay, nagsungkod pa ko ana, and then ngayon wala na, pero of course hindi pa rin ako maka-bend or maka-squat talaga kasi matumba jud ko. Okay, dili siya malak kay grabe ka atrophied akong grabe ang pagka-atrophy sa ako ang quadriceps. Okay? Changes na yun, it will really affect the mentality or the mental state of the patient talaga. Okay? Kailangan talaga niya ng support. Buti na lang malakas ang loob ng sir ninyo at hindi nagpadala sa kanyang disabilities. Bitaw, okay? Kailangan ako nga makapulos sa kalibutan, no? Kung sa pangagibuhi pa ko sa Ginoo. Given me a lot of chances to live, to survive. Ayan. So, nursing diagnosis natin dyan, impaired gas exchange. Asan na ba yun? Move ko muna ito dito. Ayan. Impaired gas exchange related to carbon monoxide poisoning, smoke inhalation, or upper airway loss. Okay, so you have to maintain adequate perfusion tayo dyan. Ineffective airway clearance related to edema and effects of smoke inhalation. Maintain, ang goal natin, this is now the outcome, ha? Ito yung ating patient outcome. Okay? Outcome, outcome tayo dito. So maintain patent airway. You also have their fluid volume deficit related to increased capillary permeability and evaporative losses from burn wounds. So restore optimal fluid balance and perfusion of the vital organs. And you also have their pain related to tissue or nerve or emotional impact injury, assess level of discomfort, administer pain relievers, and provide emotional support. Ito yan siya dito. Of course, interventions na ito. Okay? Ito siya outcome. Ito outcome. Yan. And this is what you call your contractures class. So as you can see, so you have here the head and neck that is involved, no? Nasunog yung kanyang head and neck. Okay? So what do you think will happen? The range of motion, okay, yung pag-turn niya from left to right or maybe tilting his head up is will be diminished, no? Malilimited yung ating range of motion, and this is as well part of your contraction as well. So as you can see doon, dapat dito yan siya dito, dapat may cut yan siya dyan. Okay, so may times na pinuputol nila ito dito. Unless na lang, no, if ever ma-include dyan yung mga major blood vessels natin or major nerves, so that yun din ang titingnan nila, okay, to make the cut. So, pero ito yung example of your contractures. Grabe ang extent na kanya pagkasunog, no? Sa anterior talaga, no? It's like whole of the, nasunog yun ang iyong likod, apil ang iyong upper extremities, no, sa arms niya. So, this is an example of your contractures. And ito na yung gusto nating makita, isang maitim, no? Mga mga itim sa ating kinabuhi. And remember, di ba yung sabi ko sa inyo that paitom-itom lang ni, pero kaya na mo kuluran inyong kalibutan. Charot. Okay? So again, okay? So again, this is your clinical instructor, Mr. Alvin Natone, saying, panoorin nyo ito kasi kayo na ba, this will be part of your examination as well, no? Sa inyong midterm examination. Sige. Chill and chill out, guys, and bye-bye.